So good morning everyone. I think we can start. Sandy is here, and today's topic is the fluoroquinolones, folic acid antagonists, and urinary tract antiseptics. And we will mostly discuss the fluoroquinolones because they are most effective antibiotics currently available, and because of the fluoroquinolones were so effective, they have been used for many diseases, and uh, because of that, many bacteria acquired a resistance for the fluoroquinolones and other antibiotics, and that is a collateral damage that actually is done with the um, commonly used antibiotics. So most of the resistance that is obtained with the antibiotics is obtained because of the fluoroquinolones, and that actually makes them not so popular nowadays. So that is why the prescription of fluoroquinolones is less frequent today. And the fluoroquinolones are nowadays represented by the mostly by the levofloxacin and ciprofloxacin, and also the moxifloxacin, and nalidixic acid is the prototype of the fluoroquinolones, and that it's not effective anymore as antibiotic, so because its spectrum is not as wide as other fluoroquinolones, and norfloxacin and ofloxacin as well. So mostly these three, ciprofloxacin, ciprofloxacin, and levofloxacin, and moxifloxacin, are used for the treatment of the diseases. Also, today we will discuss the folate antagonists, or sulfa drugs, including the sulfasalazine and trimethoprim, also, that is folate reduction inhibitor, and also combinations of these two groups, that is cotrimoxazole, that includes the trimethoprim and sulfamethoxazole, that is a combination of the two previous groups, and is mostly effective and has wider spectrum of action, and most useful of the sulfa drugs, sulfa antibiotics. And then also there is methenamine, that is a urinary tract antiseptic. It's not an antibiotic, but can be used for the urinary tract infections. So this is the plan for today, and we will start with the fluoroquinolones. The mechanism of action of fluoroquinolones is inhibition of protein synthesis. So, and the uh, the antibiotic spectrum of these include mostly the gram negative microorganisms, but also the some gram positive, like for example Streptococcus pneumonia, especially the resistant strains for the beta-lactam antibiotics. So, and levofloxacin actually is the drug of choice for the pneumonia caused by the Streptococcus pneumonia, and can treat those patients which are resistant to the beta-lactam antibiotics, like for example amoxicillin combined with the clavulanic acid, that is beta-lactamase inhibitor, because these fluoroquinolones are resistant, so they resistant to the beta-lactamases because they don't have beta-lactam ring, and that is why this resistant is not covering the fluoroquinolones antibiotics. And then ciprofloxacin is no longer a drug of choice for the pneumonia because of the its resistance. So because Streptococcus pneumonia is resistant or to the ciprofloxacin to some level, and that is why for the respiratory infections ciprofloxacin is not used anymore. So instead levofloxacin and moxifloxacin are used for the respiratory infections because they are more active towards Streptococcus pneumonia. Then also can be used for the anthrax, but anthrax is very uncommon nowadays because this is actually a very rare disease, usually found in Siberia and in the cold countries where the bacilles can be saved underground, freezed, because most of this disease is not common anymore in the modern world, and also doxycycline can be used. That is the protein synthesis inhibitor. So I'm sorry, I thought that fluoroquinolones are protein synthesis inhibitor. Is not true. They are DNA synthesis inhibitors. So the DNA inhibit RNA synthesis inhibitors. So ciprofloxacin can also be used as well as a doxycycline. So actually most commonly drugs used for the treatment of the anthrax. Usually the mostly is done with the prophylaxis after the exposure to the anthrax, that is usually seen in healthcare professionals that work in the microbiological laboratories. Then we have gram-negative microorganisms, including the urinary tract infections, and nalidixic acid commonly was used for the treatment of the urinary tract infections, and ciprofloxacin and levofloxacin are used for the uncomplicated urinary tract infections. That can be the agents, causative agents can be Escherichia coli and Enterobacter, also Serratia. So then this other, like Escherichia coli, is commonly will lead to the, and Pseudomonas aeruginosa will lead to the GI infections, and ciprofloxacin is efficacious for the treating of these diarrhea illnesses because of the enteric pathogens like Escherichia coli, and Haemophilus influenza is usually a respiratory infection. And then also moxifloxacin will cover the anaerobic infections, but others will not. So that is the antibiotic spectrum of the fluoroquinolones. And the drugs can be injected intravenously and also taken orally as a tablet, and they are metabolized by the liver and appear in the urine, are released by the urine, and there is a resistance, and resistance is a problem, and the resistant strains will metabolize the antibiotic, and usually because of the cross resistance with and resistance is cross resistance, so that's why if, for example, antibiotic is resistant to ciprofloxacin, then it can also be resistant to the levofloxacin and moxifloxacin as well. There are also ophthalmic preparations for the ciprofloxacin and levofloxacin and moxifloxacin. So they are used as eye drops in ophthalmology. And the orally taken antibiotics should not be taken with the milk or yogurt. So despite the yogurt is very tasty and commonly taken at the morning, so the absorption with these dietary products will decrease the bioavailability, and that is why should not be used with the calcium containing products, or with the sucral fat, aluminium or magnesium containing antacids, or dietary supplements containing iron or zinc. All these can reduce the absorption. So any 2 or 3 cation ions can usually metals can decrease absorption. And the fluoroquinolones distribute well into the bone and urine. Moxifloxacin is an exception. And also they distribute to the prostatic fluid, for the prostatic tissue, that is important for the treatment of the bacterial infections of the prostate, because most antibiotics don't distribute to the prostate. Still, they don't distribute to the prostatic fluid. And also fluoroquinolones distribute very well into the lungs. So then they also active against the intracellular organisms because they accumulate in the leukocytes and macrophages, and so adverse effects include the diarrhea, nausea, headache, dizziness, and tender rupture. So tender rupture. Also, there is a phototoxicity, and because of the headache and dizziness, drugs should not be taken in epileptic patients. And also the hypoglycemia and hypoglycemia and hyperglycemia can be seen in the diabetic patients. The articular cartilage erosion can be seen in the children. That is why should be avoided in pregnancy and lactation, and in children under 18 years old. And tender rupture has increased risk, so should be monitored as well. Also, moxifloxacin can prolong QT intervals and predispose the arrhythmias, and because of the QT prolongation, and some antibiotics like ciprofloxacin can increase the serum levels of the theophylline because of the metabolism. So, and also same for the warfarin, caffeine, and cyclosporine. So usually, mostly these fluoroquinolones are well tolerated, especially when used in the monotherapy and without combination of other drugs, and if taken without the supplements, food supplements containing the uh, 2 and 3 valent metal ions. So actually the ciprofloxacin decreases the metabolism of these drugs, so that may lead to the overdose of warfarin, for example. It will lead to the bleeding. Terpheline will lead to the agitation, and cyclosporin may lead to the toxicity because of nausea and vomiting. Then the next group is sulfonamides and sulfur drugs, and usually they are not prescribed without combination with the trimethoprim, and because of the low efficacy and mechanism of action is inhibition of the enzyme that will synthesize uh, folic acid. So because the cell membrane of the microorganisms is non-permeable for the folic acid, they have to produce folic acid themselves from the para-aminobenzoic acid. So and para-aminobenzoic acid is produced also in cells inside the microorganism cell, inside the bacteria, from the pteridine precursors, and then the enzyme that is called dehydroteurase synthetase will make a dihydrofolic acid, and the folic acid actually, and this step is inhibited by the sulfur drugs, or for example sulfur metaxazole. Humans, unlike bacteria cells, human cells don't produce folic acid themselves. They acquire folic acid from the food, so that is why folic acid is a vitamin, and they use that to produce an active form of folic acid, that is a tetrahydrofluoric acid, that is used for the synthesis of the amino acids, purines, and thymidine analogs. So because of that, the sulfonamides are selective for the bacteria, because this step is absent in human cells. So then the drugs can be taken orally, intravenously, or applied as ointment topically, and also injected rectally in the form of the suppository, and excreted by the urine. Usually the tablets and capsules are used as an oral medication, and the adverse effects. So antibiotic spectrum is very narrow. So these are mostly for the treatment of the urinary tract infections, nocardia infections, and also are used for the treatment of toxoplasmosis and also malaria. So toxoplasmosis is not common in Russia, and malaria as well. So, but for example, in India and in South America and Africa, the toxoplasmosis is very common. So that is why these drugs are commonly used in those countries. Adverse effects include crystalluria, that when the diamonds occur in the urine, so like in urinary bladder here we see a very large diamond. So then uh, to reduce this adverse effect, so then this diamond tries to go out through the urinary bladder, and then from the urinary bladder to the uh, urinary tract. And because of the urinary tract is much smaller than its size, it doesn't fit the size, and it starts uh, to increase the pressure to the urinary bladder, and that results in painful episodes. So then actually requires surgery or ultrasound treatment to uh, to reduce the size of these crystals, so they can be removed by the flow of the urine, or and sometimes require a surgery. Crystalluria can be reduced by taking a alkaline solution like mineral water, or, with a tablet. So tablets are recommended to uh, be taken with the mineral water. About 2 cups of the mineral water is recommended, and also vitamin C increases the uh, bioavailability of the sulfur drugs, sulfur antibiotics. Hypersensitivity is common, then hemolytic anemia can be seen in some patients. That is why the blood should be monitored, and then bilirubin levels can increase and lead to the kernicterus. Uh, so the but usually the sulfur drugs are not used alone and are combined with the trimethoprim, and trimethoprim and sulfamethoxazole combined will uh, be more effective. So for example, this is the trimethoprim alone, this is the sulfamethoxazole alone, and this is the combined trimethoprim and sulfamethoxazole drug called tremexazole. Cotrimoxazole is very commonly prescribed by pediatricians because the drug is less toxic than any other drug, and also has a wide spectrum of action, and spectrum is covers some bacteria that are not covered by the penicillins. And so the spectrum of action includes the MRSI, because methicillin resistant Staphylococcus aureus usually result in the skin tissue infections, uh, and also the mucosa infections. So the beta-lactam antibiotics are not effective because of the resistance, but cotrimoxazole is still effective. Then Listeria monocytogenes is the will lead to the listeriosis. So and then commonly is a meningitis, and ampicillin is not effective because it will not cross the blood-brain barrier. That is why the cotrimoxazole can be more effective. Then the respiratory infections are most commonly prescribed in Russia. So the cotrimoxazole most commonly prescribed in children for the respiratory infections caused by Haemophilus influenza, and also especially in those patients who are resistant for the beta-lactam antibiotics, or they have an allergy to penicillin and beta-lactam antibiotics. It also can be treated the pneumophila, uh, diseases caused by Legionella or Legionellosis. So then also some uh, Shigella and Proteus mirabilis was also covered, and also Escherichia coli, that is mostly enteric infections or GI infections, and Salmonella, also Salmonella infections that are also GI, and also teeth is also treated uh, with cotrimoxazole. And there is also a new indication, that is pneumocystis jirovecii pneumonia, that is only seen in AIDS patients, and most effective treatment is cotrimoxazole, and is also used for the prophylaxis for those HIV patients with the very low CD4 cells. So usually patients with 500 CD4 cells per milliliter are diagnosed with HIV, and then those who have less than 200, they don't have immunity at all, so they can easily die from the opportunistic infections and complicating the AIDS. So these opportunistic infections can be treated and prophylactic with cotrimoxazole. Usually the lung infections that in normal patients the immunity can actually save from these infections, but in HIV patients they don't have immunity, that is why they die from these diseases. Contraindications include the newborns and less than 2 months and pregnant women at term. Should not be given to patients receiving methamine because of that can lead to the crystals in the urine. So and yes, methamine is actually a antiseptic that is taken orally, and then it decomposes to the formaldehyde and kills bacteria in the urine. So it decomposes only at low pH in acidic pH of the urea, and then actually kills bacteria. And this selectivity is due to the low pH of the urea, and at normal physiological pH it will be stable and will not decompose to formaldehyde, that is a very toxic compound, and actually only used as antiseptic outside, so it's not for the as antiseptic, it's used for the cleaning of the surfaces only. So that is it for today. Thank you for your attention, and see you next week. If you have any questions or comments, then feel free to leave them below.